Good evening. This is Dr. Bill White again with the American Orthodontic Society, and I want to discuss another molar here that we're going to upright, and it's on a case that's Class 2 Division 2, and I'll try to go through this as quick as I can and point out as many problems as you run into when you start doing this. This is a young man, and he's a nice looking fellow, no problem there at all, a good face and everything else, but still Class 2 Division 2, and he smiles, or then you can see those two front teeth, they're leaning way back like this, and they catch the lower teeth and keep the jaw from coming forward. And how they develop, I guess the child has a overjet like this, and his teeth, his lips press up against them and push those teeth back. Anyway, they're fairly easy to correct if you really know how to do it. In other words, we use these intruding wires and go in and hook to those teeth, and it doesn't take much of any length of time to correct them. And some people get their jaw locked back like that, and it pushes the condyle into this retrodiscal tissue that's so vascular, it's producing all this synovial fluid that supplies the food and the lubrication for the joint. Now, some people are Class 2 Division 2, and their jaw still doesn't go back against the condyle doesn't go back into the retrodiscal tissue, so they won't all come down with that, but frequently they do, and you know exactly what to do. You get a hold of the teeth and move them out, and a lot of people don't know that they can move these teeth like that. And I remember this one guy who lectures on TMJ stuff, he ground the two centrals off because he knew the jaw had to come forward, and that was ridiculous. And did pull, he went in and took the nerves out and everything else, and the lady stopped having the pain. I've told you about this several times. But this is some of the ridiculous things that people do simply because they don't know orthodontics. And this is why I want to press the fact that we should teach every dentist many of these facts about orthodontics. If they don't want to do it, get somebody else to do it, or learn how to do it, and be they aren't afraid to teach a little orthodontics to the general dentist or whoever, So anyway, I harped on that so many times. Let's go ahead and do this case. Now, this was 1990, and this is a young man. His closed bite, of course. We got that too. I mean, these teeth are down. You don't even see the lower anterior teeth. The cuspids are way down here, and the bicuspids and everything looking pretty good over here. But this locks the jaw back, and they can't bring their jaw forward. Now, a lot of people, they subconsciously kind of move their teeth against that and wear their front teeth down out there an unnecessary amount just because of this. Let's look at this again from another angle a little bit here in just a minute. But anyway, it's Class 2 Division 2, and that holds the bottom jaw back, and it's in the Class 2 relation. And my experience over the years is when you come in and straighten those teeth out and open the bite up, that the lower jaw will just move forward on its own a lot. I had one case that went to Class 3 when I did that. And I was surprised too. But let's look in here a little further. Now you see how far these teeth were, and you're going to move them out here, something like that. And when you do, the lower jaw will just move forward on its own, and you can put a little class 2 elastics on it or something, and it may require a little of that, but not a whole lot. Now let's have one picture in here where you could see where they were locked together. Now the lower anterior, the jaw was trying to come out here, and it's got these teeth tilted back, you see, and they're rubbing against those two upper centrals are coming down right in here, and he can't bring his jaw forward and get in relief. And now people that have pain with it have just a very difficult time. And there's a lot of problems in this case. You see, these teeth are further forward than these are over on this side. The cuspid is sticking out here, and it's back, caught back on this side. There's a whole bunch of different things that are wrong with the case. You hardly ever get a case with just one thing that's wrong. And now, okay, this you can see. Now look right here where the lower anterior teeth come in contact with the upper anterior teeth in this, and the upper roots are back in here somewhere. They come in maybe a little more up there like that. And when you take these teeth out to here, you're going to bring the root structure back some, and that as you back those or as you bring these crowns forward, the roots are going to tilt out, the crowns are going to tilt out in this direction. The roots will try to go back here, but they don't move very much. So your whole thing moves forward slightly when you correct a Class 2 Division 2. Now that makes your Class 2 problem even a little more. In other words, you're trying to get this point of that tooth into that groove right there, and this molar, this part of this molar is supposed to go down in that groove of that right there. This tooth here, and this tooth is going back there. In other words, there's quite a bit of movement here, but when you pull this out and you bring these teeth kind of intrude them a little bit so they can come out, then frequently the lower jaw will just move forward a great deal of this Class 2 area. And the Class 2 gets slightly worse when you go to fix these. As you prise that upper tooth back, the roots don't want to go back, the crowns want to come out like this. And so you bring them out there, but if you have to hold them back to keep from forming a space, this whole maxilla moves forward slightly, very small amount when you go in there to do that. Okay, let's see, but you can see what a Class 2 Division 2, this is a perfect example of how it locks the jaw back. And if the condyle is jammed up against the retrodiscal tissue and it's inflamed and sore and all this, I've had people that have hurt for a long time and nobody realized what it was, the blooming teeth, that was holding the jaw back, and that was what caused the pain. And when you got rid of this, and I don't give a darn, I mean, you can rub all the salves and everything you can think about and take all the painkillers you want to, and it won't do any good on a case like that. Now, sometimes you can take something and get rid of the inflammation around the joint, and it's when it shrinks up in the natural, it doesn't hit, and that'll get well. So the medication does good there, but none of this stuff fits a pattern, and every one of them you see will be that way. See, Now sometimes you can do whatever you want to the joint back here, and if you got this as your cause right there, then that's what you have to work on. So I'm gonna go on from here and show you. So this, we jumped ahead a long way. So here's the intruding wire right here. See, this wire would go way down here, and we pull it up, and it's a rectangle. We've already done the upper intruding wire, which would come across here, and we pulled it down and hooked it to these teeth. And I've had cases that these teeth straightened out here in a matter of 2 to 3 months. And I had one that did it in 1 month, so they had short roots on the teeth. They had short roots when they came in, though, and you make sure you know about that. All right, here's the Class 2 Division 2, and this is 90, and there it is corrected there. Now here again, the Class 2 Division 2, and there's where it is with the intruding arch in there, and we brought those teeth out to that. And when we got that all lined up, then there was very little bit of a problem in here finishing the case out. And here's the bottom arch right here, and we got the teeth straightened out. We still have the intruding wire on that. A lot of this I didn't show you. It's just a regular thing here. And now here's the metric from the beginning of this, and you can see where these teeth are up in underneath there. And here is the thing that I wanted to show you. Now I've got 4 wisdom teeth here, and we've got very little room for these wisdom teeth. Even if you get the 12-year molar up like that, it's going to have a hard time getting it in there. So we've got a problem. So we went ahead and recommended removal of the wisdom teeth right here, and so you can see what it looks like after we got the wisdom teeth out. And then I came in and bonded a deal right on this corner of this tooth, and we had a spring or something like this, and it would come off down like this, and you raise it up and hooked it in here, and it'll raise that tooth right out of that spot. And we'll show you. And everybody ought to know how to do that. That is such a simple, easy way to do it. And I've seen some of the craziest things people try to get these teeth up. And it's so simple to do. So anyway, I want to say, and it looks simple. I mean, sometimes you have to take an electrosurge and trim the tissue here so you can get something on the side of the tooth, but it's got to be on the side. And I use a rectangular wire because you can activate it over 45 degrees sometimes, and it'll roll if it's a round wire. And it needs to be a rectangular tube, of course, you put on the tooth there to bring it up. Now let's see, here we drew this out for the patient and showed them what we were planning to do. You come out of here and just had this around here, and this would go down this way, and we come up here and measure it, and see, we drew it hooked up to that tooth right there, but you put the hook right behind one of your bonds or one of the brackets that you have on it. You could take somebody and just stick a wire on these teeth and do the same blooming thing with it, and just bond a wire on it to the teeth. I've shown you several videos with that. So let's get on and don't take any more time. And I've got something that's distorted over here. That's really not like that. And now we'll come in, and we still haven't hooked it up there, but we've taken the wisdom teeth out we took the lower ones. We just left the upper ones, I guess, and that they don't bother anything. And then you can take them out if they erupt in. All right, we put that deal on, and we stuck it right on the tail end of this right here. And it doesn't matter if you just get it, as long as you get over on the side of the tooth, and activated this thing and got it up and hooked on this wire, and it's got the thing going here. Now this tooth will back out of here. See, the roots are still in the bone, and that part is going to be hard to move. The crown will go backwards, and of course we took the wisdom tooth out back here, so it took some of the force away, but it would upright that even though the wisdom tooth is in there, and I've done that on them. And there, let's go and see what we have. Another, the young man is 15 years and 7 months old right now. Now this, and here we did, and it is. If we backed it out where it opened a gap in between the teeth. Now that's because these roots are in the bone, and you pushed on this crown, and this may have moved forward a little bit, but not much. The crown came up here. Now we hold this pressure on it and tie onto this and pull it forward, and as long as we've got this pressure, the roots will go forward with the tooth, and they'll go up, and you'll bring the tooth forward, and it'll be parallel, just about like this over on the other side, which was slightly tilted and corrected without anything. Okay, here's another Panorex here. This is number 6, and now that we have pulled this tooth right up, and these are parallel roots. And what we did, we kept this downward pressure on this and pull forward, and you'll move it forward. Now if you get the root too far this way, you've got too much of this. If the crown comes forward and the root stays back, you're putting too much force on this forward for the amount of force you've got to bring the roots forward. And we didn't really do this good. We're not totally through with this, so we could put some tip in this tooth going this way, something like that. It would tend to bring that, maybe that's too much, forward. But anyway, we corrected the Class 2 Division 2, and this move forward. We had to extract the lower wisdom teeth. There's hardly room for the 12-year molars in here, much less a wisdom tooth, so we took them out. But we left the upper ones. They're not going to bother us. So if you lost this tooth right here, we could slide this one over and bring that down in that place. So there's no need taking them out for that. Let's see. Now here he is. We put in an upper retainer, and we've still got the braces on the lower arch, and you notice we put the brackets way down here. It doesn't make any difference here as long as you figure out what the upper is wanting here, and you come off the molar, and I put all my molar bands about 3/4 of a millimeter lower to keep from running into them with the upper buccal cuss in there. And we've got this wraparound retainer that nothing, I don't like any wires going across underneath there. And these you can make them where they stay in the vacuum holder. If you want to lock them in, you can put a little real good composite under one or two of these teeth, on the side, and you have to snap them in, and you can't hardly take them out. And you do not need these wires running under the teeth. And you send them off to a lab, and you do a bunch, and they'll make them that way, and I can't get it across that you do not want those wires under there because they bite on them. Now this is the lower. We're really through with it. I don't think I have anything after we took them out of the lower. Okay, there's the upper, and we put a bite plate, and we'll have them bite in here, and as long as they use that, there won't be any deepening of the bite, and the Class 2 Division 2 won't come back, and their jaw can stay forward, and their joint does so much better. So I'm gonna finish up here right quick and hush. And I think this is a distortion. I had a mirror stuck up there that's just, that there is a whole tooth in that area there. And the upper looks like that, and that's the end of it. And I appreciate you watching this, and I've done several of these uprighting teeth, and you really you don't even have to. Let me put a deal up here where I can draw. Like if you have a molar sitting back here, and you've got another one over here that's lean like this, you can put this same thing on there and come out and run this deal like that if you want it to go up, and bring it up and bond to a bicuspid, or you can have a wire on about 3 teeth, raise this up, be down here, raise it up and hook it on that, and it'll upright that tooth, and you can put a bridge in there of normal side. Don't try to cut the dadgum preparation in a tilted tooth. And that's something that every dentist ought to be taught how to do that. And that would help so many people that have to, where we have to have leaning teeth, and they try to crown them like they're leaning. So anyway, hope you get something out of this, and I'm going to say goodbye. We've spent 22 minutes here, looks like, a little bit more. Thanks for watching. Join our group and subscribe to it. I'll appreciate it very much. So I'm going to stop here and try to get this thing over. Thank you very much now, and good night.